Hi, welcome back to season 4 of the Tummy Team Journey. I am Kelly Dean, physical therapist and founder of the Tummy Team, and I'm your host. This is the podcast where we talk about how investing in your functional core and pelvic floor strength can actually change your life. So let's get started. Hi, everybody. It's Kelly Dean here from the Tummy Team. Welcome back to the Tummy Team Journey podcast. And I have my friend and colleague, Megan Miller, with us again today. She is becoming a regular on this podcast because we have so much fun together. And she's just such a great resource. And I feel like what we do is similar, but also like different pieces of the puzzle. And I just feel like it gives you guys a lot of information that is really valuable. So, welcome back, Megan. Thanks for coming.
Thank you for having me, Kelly. Great to be here as always.
Yeah. Today's topic is men. I don't know what to say beyond that because I've done diastasis recti in men. I have a lot of men that I've interviewed as clients on the podcast. But one of the things that we have so many men that reach out to us at the Tummy Team, and I think they're very underserved in the functional core and functional pelvic floor weakness realm. There's a lot of stuff out there for prenatal and postpartum women. There's some stuff around prostate out there, but I see primarily men that have a diastasis, and you see pelvic floor with men. And I just feel like we get so many questions, and I just wanted to have a conversation about all the different clients that we see, what's unique about treating men, how well they actually do when they can find the right person that can help them, and just kind of have a dialogue about that. And I think you're totally up for that, right?
That sounds great. That sounds perfect. Yes. And I always say I love being part of these conversations where we can kind of shed light, no matter what the demographic is of people or clients that we're talking about. If we can bring more information, more conversation, more resources for people. But I agree with you. This population, this specifically in terms of men, pelvic floor issues, functional core issues, I think there isn't as much out there certainly as there is maybe for women. So I'm excited to see where the conversation goes.
Yeah. Well, I would
Mhm.
say I would say that everybody with functional core and pelvic floor are pretty much underserved in our medical world, right? I mean, but then there's this niche of men, and for me, um, what happened, years ago where was I started working with prenatal and postpartum women, which was the demographic that resonated with me because I was prenatal and postpartum, right? And then I started actually seeing a couple of my clients um husbands, like they would go home and they would tell them about diastasis, and then their husband would be like, I think I have that, and lo and behold they would have diastasis recti. And then I would start seeing some clients just for transverse abdominis work, even if they didn't have a diastasis, because they had some back instability or SI instability, or they had chronic pain and they had tried a lot of things. And I just kind of started to be known in my community for that person that could work with people that had obscure things going on, um that and they could get better. And honestly, it kind of just reinforced what I was learning, that how important the transverse abdominis and the pelvic floor is to our overall systemic health, how it helps our digestion, it helps our mood and our energy, it helps our bladder and bowel function, it helps with back pain, even just how people think and how they feel. Their posture is so representative of that. And when people are in chronic pain or have had, things that are even unrelated to the core, it starts to to drift into functional core and pelvic floor issues, and that's where I started working, and then I would have people online reach out, and at first they would do my women's program, but it just got to the point where these men were sifting through all of this prenatal, postpartum content, you know, desperate to get something that might apply to them. And then I finally went down the road and said, I'm just going to make a course that doesn't talk about any of that, that just talks about what men are dealing with. And because of that, I could address things a little bit quicker and in a little bit different order than I do for women, because men's bodies just respond differently and they learn differently, they implement things differently. There is something to be said about just a different approach that is more effective for men. And that's kind of how I started seeing men. And now I would say probably 50% of my clients are men, and I think that's mostly because a lot of people aren't offering a service that is relevant to men, and so they find us, which I'm grateful for. I'm happy to work with them, but that's kind of like my journey to help working with men, and then just the more men I have on my caseload, the more I realize how desperate they are for information tailored to their circumstances. So that's how I've kind of addressed it. I'm curious with you how your journey to working with men, because you probably initially worked in a female focused clinic, right?
Yes, for sure. So when I first started doing this work, it definitely was focused more on women. And then, over the years, over the last 25 years, it's evolved. Of course, I still work with a lot of women. I work with a lot of kids, as we've talked about before, kids of all ages, toddlers up to teenagers. And then I have a demographic of men that I work with. And the practice where I used to work actually did see quite a few men.
Okay.
So it's something I've been doing, for a while. I'd say, at least probably 12 to 15 years, but probably more and more as the years have gone on. So I would still say in my current practice, the percentage of men that I see is less than women and less than kids. But I'm really struck by the men that I do work with, like how profound their issues are, and how, just like with women, just like with kids, they so significantly affect quality of life. They're limiting in terms of activities and fitness, and there just really aren't a lot of resources out there for them. So I really enjoy working with them because they really kind of soak up the information and really, put it into practice, and see really nice results, which is exciting. And I'd say the men that I see, kind of like you were saying from when you first started, often are like friends of somebody who has seen me, or the brother of somebody who's seen me, or it's there's like a relationship as to how
Yes.
they kind of found their way to me. um, but yeah, their men are great to work with. There's certainly differences, as you said, but it's, as in any group that we're working with, it's just great to see when they can make progress with functional core strength, with pelvic floor symptoms improving, how it really, can open up their world again. Which
Yeah.
so
Yeah.
it's exciting to see. Mhm.
Yeah, it is. And I feel in general that they are not that I think most of my clients are super grateful, but the men that I've worked with tend to be very grateful for somebody to take their symptoms seriously. I feel like in terms of diastasis recti, if they haven't been diagnosed with a hernia, and sometimes they're diagnosed with both, right? They are dismissed a little bit by the medical community. I find it surprising, well, I'm not surprised anymore, but I think people would find it surprising how, emotional it is for men when their core is like a belly, where they have a belly when they don't feel like they should, when their stomach is sticking out, where it doesn't feel like them. They don't wanna take off their shirt at the beach, or, they're self-conscious of, like, getting a suit because they can't button it. And it's not simply about how they look, but there is a component of they're doing all this work, and they're maybe a lot of times they're exercising or they're trying a lot of things, and their belly's just not responding. And some of that is because they're very disconnected from that internal core muscle. And as a result, they're pushing out on their tummy all the time without even knowing it. Um, or without having another strategy that they can use. So to not be dismissed, and to be validated, and to recognize that, okay, there's, and then, and not only what it looks like and how it's presenting, but then for me to ask additional questions about their energy, their their bowel habits, their back pain, their posture, things that really do impact their everyday life, and then to start to see how all of those components are kind of pulled together. Also feels like, oh, we say a lot of the time common and normal are not the same thing, but a lot of the symptoms that we both see with people are things that have become so common that unfortunately they're dismissed as normal. And we know that that's not necessarily the truth.
Yeah.
So being able to do that. I wanted to talk a little bit. I see in my practice some generalities between different ages of men. And it's not for sure not all, but I'm going to share that, and then I'm curious if you have some other generalities, so that I think sharing generalities helps people not feel alone, and help, because when it's happening to you and nobody's talking about it, you feel like I must be the only person like this. But I think that, so I'm going to start with that, and then I'm going to have you share maybe some current clients that you're working with, or some things that you're seeing, and whether they're general or they're not. I think it's helpful for people to hear different things. So in general, I have a younger group of men that are in 20 to 35-year-old men, and those tend to be my diastasis recti men that are also athletes. They have a muscle imbalance, some instability, some pain, and they're mostly core symptoms, but I know they have pelvic floor weakness as well. They just haven't identified it. They're typically really fit, but occasionally they're just deconditioned. I have some athletes, and some people that have really powered through life with fitness. And you had mentioned that in those patients, you also see high pelvic floor tension in that type of patient, right? Those younger
Yes,
ones.
yes, yes. I would say, in that younger group, because they do tend I would agree with you, they tend to have, they've gotten in this pattern of using those outer abdominal muscles, all the time, and
Mhm.
bearing down and sort of pushing through, and so that creates this, like, tension or this, muscle imbalance with the core and the pelvic floor, and so they're always like tensing those outer layer core muscles. Sometimes the pelvic floor responds to that with tension because the muscles are so connected in how they function. So then they might be having symptoms like constipation, difficulty emptying their bowels, possibly some bladder symptoms. And usually until they come and talk to me or talk to you, they haven't really put those pieces together. And I hear all the time, "Oh, I didn't realize how all this was connected like this." I think that's like interesting for people to learn, but then also like bring some comfort, like, "Oh, okay, I'm having these symptoms and here's, a potential reason." So, yeah. Mhm.
Yeah, and I also think with those that high intensity kind of athlete type person, they've learned to power through a certain amount of pain for their sport or for their activity that they do. Um, they're somewhat connected and disconnected from their body, right?
Mhm.
They're very hyper focused on how to throw that ball, but not how tight their hamstrings are holding their pelvis to be able to do that, right? Like there's a lot of like everything's really tight and there's so much tension. The hamstrings have tension, the hip flexors have tension, their external core muscles have tension, their pecs have tension, their lats have tension. And they may think that they may mistake that as all these muscles are strong. Tight muscles and strong muscles aren't always the same. And what happens is they're overusing those mover muscles without having the balance of the internal stabilizing muscles. And when they don't have that balance of those internal stabilizing muscles, the difference between the two becomes stronger and stronger. And now we have stuff like bracing out in the core causing a diastasis or rib pain because they're pressing out on their intercostals or pelvic pain because they're pressing down into muscles, um, hemorrhoids, stuff that they don't think are connected. But it's all showing how we're pushing and pushing instead of training everything to kind of hug and support and this softer yet pliable and maneuverable muscle groups, right? So
Mhm.
hard.
Yeah. 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 I totally agree. Yeah. And they're just really, as you said, they're just really focused on that, like, tightness and tension and getting stronger for what they want to be doing. But it's these underlying muscle relationships that aren't always on the radar, but can really make the difference once they're kind of made aware of that. Mhm.
Yeah, and I think that the biggest part of the journey that I have with those clients is and they this is their timeline somewhat is they have to realize that they have to slow down and do less to be able to do more. And that is so hard. The way I get them there is I start training their core as much as I can. Elongating belly breath, transverse activation, elongating belly breath, transverse activation, and then doing a lot of releases, combining that release, replace, reset, release, replace, reset. And once they can start feeling that deep core, their body is more gives them permission somewhat to let go of some of that other tension. But it's hard to do that when they've got their pedal to the floor, gas pedal to the
Yes.
floor, right? And
Yes.
I can tell them to take their foot off the gas, but until they voluntarily take the foot off the gas and see the benefit of it, it's hard to get there.
Yes.
So I'm
Yes.
always trying to help them do get to their goal, do their sport, do their activity the way they e effectively, but also saying to do that, we need to take 2 steps backwards to be able to take a step forward. And
Yes.
that's the hardest challenge. Would you agree?
Yes. I would totally agree, totally agree. I've had people say to me, I mean, just recently I had someone say, "So you actually want me to do less of this exercise?" And I said, "Yes." And they said, "Okay, that's just so different than other therapy I've done." And so it's like a
Less
different, yeah.
intensity, less
Yes.
reps,
Yes.
maybe more frequency,
Right,
um,
right,
right?
right, right,
Uh,
right,
More consistency maybe,
right,
but less
right.
intensity.
Yeah,
Um,
less intensity, less reps. Yeah, so
and
that's a hard concept for especially that age group to kind of wrap their head
yes,
around. Yes.
that age group and that demographic of athletes or gym rats or fitness buffs, but I will say once they grasp it, they are like true believers. They are like, oh my goodness, this is so much better, and then I there's a part that they realize what I was doing was unsustainable and desperate, and now you're showing me that, oh, I could actually make better gains with less pain and it's sustainable and 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 I can see a future to this. I think that what happens is they start grasping to try to make it work, make it happen because they don't want to lose the identity they have in the activity that they're doing. And I don't want them to lose that either. But we need to shift gears a smidge to make it effective.
Right.
Um,
Totally agree. Totally
yeah,
agree.
yeah. And it's fun when we get there. I have one client that is a award-winning bodybuilder, um, who had never knew where his transverse abdominis was.
Wow. Wow.
And a personal trainer, and, and it just really, like, he was like, "Even how I was taught to lift my whole life was to press out into the weight belt, to brace out, to hold my breath, and for me to, like, I open his eyes to that exhale, and draw in, and he was slowing down the intensity of his own workouts to be more of a personal trainer, but he was starting to get a pot belly because of it. Um, and then he was reacting by overdoing external ab work, which was actually making it
Making
worse.
it worse.
Uh-huh.
Mhm.
And
Mhm.
so it was just like, how can I be a personal trainer if I've got this belly, but I'm so fit, like, and all this stuff. And so it was just a lifeline for him to get his
That's
core, and then
awesome.
he and then at through the process, he was able to share, "I have had long-standing back pain for so long, and now it's gone." Like,
Wow.
stuff that he had just been powering through and he didn't even bring up in our initial 3 sessions, right?
Wow. Wow.
So
That's great. I mean, he was probably so thrilled to have that
and
missing piece.
now he's treating all of his patient or all of his clients, with their
That's
transfer,
amazing.
which is also awesome, right?
That is. And I think it's important for not only for this, like, younger age group, but any age group with men,
Mhm,
I mean, and
mhm.
women too, but talking
Yeah,
about men today, to help them understand that, like, it's not like you can't do, like you were saying, it's not like you can't do the sport you wanna do or the activity you wanna do, but how do you back up a couple steps and learn this inner core transverse connection, do some releasing of things that are working too hard, allow your body to learn how to use that inner core system, and then learn how to put that back into the
yeah,
stuff that you really wanna be doing. So it's not like you can't do anything forever. It's like,
yeah,
let's back this up, let's add these pieces, but then let's put that thinking and way of doing things back into what you
yeah.
really want to do and make it more effective and feel better for you.
Yeah, and creating quality. So, like, my sport is swimming, right? I'm a swimmer, and one of the things that swimmers do is we do drills where we will break down. We'll, like, do one arm butterfly, or we'll do extra rotation freestyle or something where we're trying to improve the efficiency or the quality of our stroke. And if I just go back to swimming, I could do it incorrectly. So I have to break it down, and then I have to slowly build it back in to the thing. And so in my functional core course, I actually have break down a bunch of sports for people into drills. Like, how do we get the core active for a volleyball player, and then how do we take that and just work on doing one, against a wall? Can I, like, take it out of the actual volleyball game, but just take it into, like, I'm just gonna go through this, the spike or the serve or the set, or going through the components of it, and then we start pulling them together and pulling it together. And I think that most athletes that have been coached know how to break down something and pull it back together. And that's the same thing I look at when I'm doing it. But if they're more not at they haven't been coached in their sport much, they've just been doing it, then, I do look at it as a coach to some extent, and
Yeah,
break
I
yeah,
yeah, I love that, and I love that about the Core Smart Fitness program that you do that, that you have that all of those different sport examples. I think that's fantastic. Yeah. Yeah. So,
because
and
it's
I think, oh, go ahead.
yeah.
Sorry.
Well, it's different things for each sport, and sometimes, they can't see it, so it's nice to have an outside person to say, "I'm not saying you can never do this, I'm saying this is how you need to do it, and you can't do it that way yet." And I think that that's different, that's when we talk about functional core and functional pelvic floor stuff, that our approach is maybe different than just going to an average PT that will fix the problem, but are they integrating it back into what you're doing? And that's the missing piece. And some are and some aren't, right? So yeah.
Yeah, yeah, and I've heard that from even just some men I can think of that I'm working with currently. Lately, they've said to me that they're surprised that it's not like this approach isn't just like exercises that you do at the gym or like exercises that you do at night, like on the floor, that
Yeah.
it like they're like, oh, I didn't really realize that like I'm doing this at the gym, but I should be actually doing this like all day long when I'm getting, when I'm picking up my kids or getting stuff out of the car. Like I
I
think that piece
yeah.
surprises them. Mhm.
That's the biggest eye opening for my bodybuilder guy. He said the biggest takeaway for me was when you said it's what you're doing outside the gym more important than what you're doing inside the gym. And he was like,
Mhm.
"What?" you know?
Yes.
But then
Yes.
once he got that, that was the turning point.
Yes.
Um, it's your core and your pelvic floor assist you in everything single thing you do all day long.
Mhm.
So, you have lots of opportunities.
Yes,
Yeah,
yes, and all day long is so much longer than that hour in the gym. So,
yeah,
as you always say, Kelly, what you do the most wins, and the positions and the postures that you're in, that's what your
mhm.
body learns and adapts to. So, it's all the functional life stuff that's where the magic happens, I think.
I agree, and I love it when people grasp that and get that, and that's not to say you have to do this all day long, all the time. Once your body starts using your muscles properly, it naturally uses the muscles properly. It's just when you challenge or you're doing something unusual or repetitive that you might have to be cognizant of it, right?
Yes. Yeah.
Initially, everything it's just like learning to drive a car. Initially, everything bombards your brain and your nervous system and your thoughts. But then certain things become more automatic. You don't even have to think about that. And now it's this next thing. And depending on how complex the movements are or how um, new they are or unfamiliar they are, or even overly familiar, where you've done them that way so long that you have to shift something significant to change it.
Retrain. Right,
Yeah.
right. Yes, I say that a lot, that there is some thinking involved in the beginning and some intention with a lot of the daily life pieces, but that part gets less and less as time goes on, as your body and your brain kind of like really develop these new motor pathways of how to just do these everyday activities in a different way, where you
Yeah.
have to think about it to make that happen initially, but then, as time goes on, it gets more and more reflexive, and then you just find you are blowing out when you're lifting up your
Yeah.
kids, or you are, rolling onto your side to get out of bed instead of just popping right out of bed, or whatever it might be. That it just becomes this reflexive way that you do it, and it always, I think, feels better. So that's why your body gravitates to it as well.
Yeah. Once it's unfamiliar at first, but it usually feels better. Um, it may not feel better at first if we're putting them in positions where they're not strong enough to maintain it, then or they're really tight. So that's part of our process with them to get them there, but they'll get there. Um, the next group of guys that I tend to see are midlife, a little bit more midlife, 35 to 55. And with my guys, there tends to be this they've deconditioned. They have a bulge, they have back pain, a bulge in their belly, back pain, postural issues, maybe GI, hernia, maybe some hip pain, They have a variety of activity levels, but there's often a gradual decline in their fitness or their overall strength because they've been focused on work or family priorities. And now they're like, I'm done with it. I'm going to start working out, but they have no idea how to proceed. And the first time they get back to the gym, they're like, what is happening with my stomach? Or what is happening? What's going on? And I know that that group of guys are my core guys as well. They do have some powering through stuff, but more often these guys respond really well because I start retraining what they're doing in their work and family life priorities, with their posture and with connecting to that muscle. And if I can get them before they've jumped too much back into fitness, then I can really,
Mold that.
make
Yeah.
mold them
Mhm,
because
mhm.
they have some distant muscle memory of working out, but they haven't been doing it recently. So I can actually help them work out smarter, not harder, and really empower them. And they do really well. But that tends to be that midlife. What do you see in that midlife group with your clients?
Yeah, I would agree with that. Definitely where they're kind of maybe have been away from fitness, away from working out, and they're looking for kind of a path back into that. Um, in terms of like pelvic floor symptoms, I mean, again, there can sort of be this combination of their pelvic floor muscles can have a lot of tension because the pelvic floor is trying to maybe make up for what that inner core transverse muscle isn't able to support. So,
Yeah.
again, more tension issues like constipation, maybe hemorrhoids, maybe starting to get some like prostate issues, some bladder changes. So, definitely some tension related issues in terms of pelvic floor. Something I've also seen recently, I don't know if you've seen any of this, but with sort of more people being on like the newer weight loss medications, like people having like a pretty substantial weight loss, and then sort of that in that process, them discovering, oh, why is my abdominal wall like what's this part of my abdomen kind of sticking out or cone where maybe they didn't there was some extra tissue there before where they couldn't really perceive
Yeah.
that or notice that. And then
Yeah.
after they've had all this weight loss, now all of a sudden they can see this like this doming or this coning or maybe trenching. So
Mhm.
I've seen a couple people, on sort of the other side of that path also in that
I
age group.
I've totally seen that, with weight loss in general, or I work with, uh, Boston University, bariatric program, has, their doctors send a lot of their clients to us that get, bariatric surgeries, um, and what we see is, like, you're lighter, so you feel stronger, but your muscles aren't stronger. And because there's been this distension that's pushing out, like anytime somebody's dropped a lot of weight, they feel stronger because they're not carrying as much weight around, but their muscles, they have been really disconnected from those core muscles. It hasn't been their happy place of their body, so they've not dealt with it well, and the excess weight there maybe was pushing out on tissues, but even just how they were holding their body was different. And so there is a really important role in connecting to the core and having those core muscles support your organs and support your back and support your body because you're losing weight. And sometimes my heavier clients actually are fairly strong because their bodies have to carry around that weight, right?
Sure.
And so when they're dropping a lot of weight, sometimes they're losing some muscle strength in that journey. It's hard to keep up. So I think that that is really valid, and learning about their body now. And it's also similar sometimes after in postpartum, that dramatic change in the belly can but you're immediately still having to do a lot of physical activity, right? But
Yeah.
with a deflated core, right? So
Right.
you almost
Right.
it's a deflated core muscle, but you still gotta get out of bed, you still gotta clean up the dog poop, you still gotta do all the things,
Right.
but you don't have that connection and strength that you need. And
Yeah, and
well, yeah,
I'm glad I'm glad you said that about the disconnection because those are the men that I try to do some of the abdominal massage and connection with all of them, but those men in particular who've had the
yeah.
weight loss, it's like really important for them to do that because there is has been um usually has been this disconnection because of maybe having, a belly or just, being uncomfortable about that part of their body. And so, just like in postpartum, when there's sort of this, can be this disconnection if women feel, if they don't love how their abdominal wall looks or, then they just kind of dissociate from it. And I think that happens with this particular group of guys also for sure.
And those people actually respond really well to, using an abdominal rehab splint as a
Yes.
feedback tool.
Yes.
It helps them feel that muscle, that's in there, and I've heard so many, overweight patients say, "I don't have that muscle," because they've got a large belly. "I don't have that muscle," and I'm like, "You 100% still have that muscle." It may be deeper in there, but it is there and it has the capacity to build strength. And so a splint can really be a really great feedback tool to what the transverse abdominis is and what it isn't. And helping them recognize that, oh, I this forces me to be in these positions and where this pressure, I feel this pressure, that feedback can be really, really valuable.
Yeah, I
Yeah.
agree. The splints is can be so helpful for men and in that sort of post weight loss situation. I mean, for men of any condition, truly, but that demographic for sure. And I think I also in that midlife age group. I don't know if you would agree with this, but I feel like I also see a fair number of men that are like have a hernia and are trying to decide if they should have surgery or maybe they are scheduled for surgery or they've already had it. There's some sort of, either
Yeah.
pre or post surgical, situation happening. And so I know you agree. I love if they can find us or, find me, find the tummy team, find you before, a surgery like
Yeah.
that would happen. And not that they may not end up needing that, but sometimes they don't. And sometimes, and all the time, if we can do this work ahead of time, the outcome is so much better, so much more functional, so that they
Yes.
don't kind of go back to the old patterns of bracing and bulging and breath holding, which kind of got them in that situation in the first place.
Well, post surg recurrent hernia surgeries are 60 to 80% of the time they have to do another one.
Mhm,
And other abdominal surgeries, 50% of the times it turns into a post-surgical hernia.
mhm.
50% of the time. 80% they need to do it again. And the reason is we aren't doing abdominal re-education. We aren't looking at what caused the hernia, what movement pattern, what muscle imbalance, what strategies are causing the hernia. So now we go in, we put a piece of mesh, we sew it together. We didn't do anything to change the problem. Now we have a weakened area. Right? So yeah, when we can I love it when somebody is finds us when they're contemplating or they're even planning the surgery, and sometimes the surgery is necessary.
Right,
But
right.
let's do some pre-surgical work so that it's gonna be as minimally invasive as possible and have the biggest success and no recurrent problems. That's where we need to be. And a lot of times with hernias, nobody's even saying, "Oh, and you also have a diastasis." Like this is the diastasis is telling us that you have functionally not been using your core muscles properly for a sustained period of time. It doesn't happen overnight. It's a sustained period of time that we need to retrain that. And I think that that's, yeah, I see that a lot. The other thing I see at that midlife is people like they've kind of shifted into a new stage. They're realizing, okay, I can't just not work out anymore. My kids aren't babies anymore. I'm going to prioritize this before I get into this next season. But they find they have this hernia or this diastasis, and then they're like, I don't even know what to do. I can't even tell you how many clients say, I don't know what to do. I've looked online and I have gotten 30 different answers, and I'm not sure what exercise is safe to do. And then I always come in as that, yes, I'm going to help you with that, but first, it's what you're not doing in the gym that's going to help you first. Like, I'm going to help you outside the gym. I want you to only do, upright low impact cardio for the first 2 weeks while we're working on this, and then I'm gonna start showing you how your core is gonna be essential to every exercise you do in the gym. And so I'm gonna set you up for success in the gym, tell you it's not what you can and cannot do, it's how you're doing what you wanna do. There are a couple of please avoid these things, they're not great. But for the most part, you can do almost all the stuff you wanna do if you're doing it with the right connection and the right muscle balance. And I think that gives
Agreed.
people a lot of hope and encouragement, and I'm not a, like, never this, never that, I'm not a big fan of crunches. I don't feel like our body needs more crunch movements, but it's not like I will never let anybody ever do a crunch, but if they have a diastasis and a hernia, a crunch is really not something, and crunch-like movements are not helping you. So, what's a better way, you know? Um,
Right. Right.
so
Exactly.
yeah. So that's that midlife area. Let's move on to our seniors. We've had lots of conversations about seniors, so we won't go deep into this, but 55 to 80 plus year olds, core, DR, prostate, constipation, urgency. Now I'm starting to see a lot more pelvic floor symptoms. I know there are pelvic floor symptoms in those younger populations as well, but it seems to be a little bit more in this senior population. They're more interested in regaining or maintaining function and movement than fitness necessarily. They're frustrated by the decline. And they don't feel like they can trust their body. Like in their mind, they're 30, in their body, they're 80. And, you know, we're trying to like address it in like a new way. That's really practical. And I know like we've talked at length, we have two other podcasts on seniors, but it's never too late, right? And what are you seeing in that senior population?
So yeah, so definitely in the senior population, more of the bladder symptoms for sure. So a little bit more stress incontinence, urgency, urgent continence, or urinary frequency, nocturia, so getting up at like frequently during the night for sure. Um, Constipation for sure. So I would say in the senior population with men, I would say in younger men, I tend to see a little bit more pelvic floor tension and tightness issues. In the more senior population, there is still some of that, but definitely some weakness also. So more of like a combination. Yeah. So still the same principle of muscle imbalance where now if they're in their 70s and their 80s, they've had a long life of moving one way and doing things one way and using their breath one way. So um so but however, it's never too late. It's
There is
never
that
too late.
long ingrained pattern,
Yes,
but it still can improve, it can we might not catch
yes,
every breath, but we can,
yes,
start changing some of those big areas,
yes,
addressing some of those significant areas that are really causing that contributing to the detriment of that.
yes.
Um yeah. I because we've talked so much on seniors, I'm not gonna go more into seniors, I'm gonna refer people to our senior, video or podcast, but I do want because we only have a little bit more time, I do wanna talk about just the things that are unique about how we treat men. And because I think there's a lot of times where people are like, "Well, it's the same muscles mostly." And it is mostly. Um, but in my experience, men respond differently and I treat them differently. I still teach about the transverse and stuff like that. But what do you, before I divulge what I see differently, what do you notice is different with working with men versus our women clients?
Well, I think that they are when they come in to see me or to work with you, they are really like, they want it to be better. They want the issue to be better, like,
They're
soon.
committed.
Yes, they're commit that's another good way to say it. Not that women are not, but
Right.
they're a little bit more, like, very intensely set on, like, the goal and how
It
do
might
we
take
what's the
a
path.
woman. It might take a woman 3 months to 3 years of following me online before they commit. It'll
Wow.
take a man 3 days. 3 days.
Yes.
They're like,
Yes.
"You know what my problem is? You have a solution, you've done it before, where do I sign up? Let's go.
Yes.
Let's get this done."
Yes.
I pull the trigger fast. Now,
Yeah,
women
I
will stay
yeah,
the course. Women will stay the course longer. Men have a shorter attention span, right?
yeah,
They want it to be fixed faster. I mean, everybody
yes.
wants it to be fixed faster. They'll pull the trigger faster, but they also need to have faster results to stay motivated.
Yeah, I totally agree with that. Yes. And I it's interesting in my clinic I do these little free screening sessions where somebody can come in and, meet me and see my space and just sort of talk about what issues they're going on and, how I might be able to help through core and pelvic floor rehab. And inevitably like if men are coming in it's like I barely have to like I mean, I explain everything, but they're very quickly like, "Okay, let's start
Yeah.
today."
Yes. Yeah, for me,
Yeah.
it's today.
Yeah.
Like,
Yes.
nope, you gotta get on
Yeah.
my schedule.
Yes, whereas women, it's like, we have longer which I love that I love that.
Yeah,
We have longer
I love it too.
conversations. They kind of have to think about it a little bit. They have to check their schedule, so that's just a difference in logistics. Like men are just
Yeah,
like, let's start now. So
let's do it.
that's
Let's do it.
yeah, yeah. And so
Yeah.
that and I definitely feel like I have to have more of the conversations about the less is more concept with men. I do. And not that I don't with women sometimes, but I do have to really frame that in a way that it's like what we're working on, we're looking at quality, we're looking at consistency. We're not looking at, like 100 reps of something. And
Right.
just a couple weeks ago, I had a client, a male client, was in my office and I had given him something to do. And I had told him I want you to do this like 3 reps of this when you do it, just 3. And so he came back the next time and he's like, "Well, I just decided to do 20 because 3 just didn't seem enough." And I said, "No, no, there was a reason for 3." So it just takes some it just takes some
You're
reining in
lucky it was
and
only 20 that he said.
yeah,
Oh, it
right.
was I just did them all day long.
Yeah.
Is there a I hear this question. Now, is there a problem if I just do them way more than you told? Yes, there is a problem. Like
Yes.
some things are like belly press, do those all day long, yeah. But
Yes,
tension
yes,
and holding? No, no, no.
yes.
Um, the good news is that men do build muscle pretty quickly. When I can get them to feel the right muscle and activate it properly, they build muscle faster than women, which allows me to get them into multitasking faster, like adding
Mhm.
more like fitness exercises and band exercises. I am able to do that a little bit sooner in the process than I do with women. Um, the other thing that's really key with the men is releasing the tight muscles, like
Yes.
getting that release, that replace, release, reset type thing where I really like once I get them some strength, the tight muscles are like just so like blatantly obvious, right?
Yes.
And
Yes.
then the releasing, and then getting in the right alignment, releasing and getting in the right alignment. Um, and sometimes those are long standing, ingrained, tight muscles, and convincing men the importance of doing the stretches.
Yeah.
Once they get there, oh, we're home free, man. Um, but it is like they really feel like it's the exercises, not the stretches they need,
Yes.
and honestly, they need the stretches more than they need the exercises.
Yes.
They need the
Yes.
function,
Yeah.
the posture, and the releases, and that learning how to teach that, getting them to be smarter, not harder, that's, I think, the biggest thing. But also
Yeah.
rewarding, right? Super
Oh,
rewarding.
absolutely. Sure. And I don't know, Kelly, if you would agree with this, but I feel like in men that I work with that have diastasis, they tend to have more like upper DR separation. So that's a little bit of a difference. Like, so when you're just talking about the stretches and the releases, I'm thinking that I'm talking a lot about with men, like the rib flaring and the chest tightness, and so and not that I don't do that with women, but certainly there's a lot
Yes.
of emphasis on that with men.
Yeah. I talk a lot about that, and I have a whole podcast on men and diastasis recti and what's unique about the presentation of DR with men. That is something we'll link in the show notes as well, because I think there are some things that are unique to men and why they are, that I talk in that. So we could talk forever, but I know you have a hard stop because you have children to pick up. So we are going to wrap this up. But you know what? If you're listening to this podcast and you want to leave some comments, or you have some questions, you can always let us know what you're interested in hearing about, and we can talk more about that in the future, because we just scratched the surface. And I hope that you hear that, working with men is very different than working with women, and we really enjoy both. And we see the differences, and sometimes people will say, oh, there's not a lot of differences, and yeah, these are somewhat, our experiences, and it may seem a little stereotypical, but I would say in general this is what we consistently see. But we work with everybody at every stage in all the different things. And if you are somebody listening to this and say, well, you know, I'm the 25-year-old, but I feel like I have the 80-year-old symptoms. Well, that's okay. That happens
Yeah.
too. Everybody's unique on their journey. And if you're having any of these symptoms, or somebody that is, just know that there is support. Check out what I do at the Tummy Team, as well as I'm going to share Megan's information. She works with clients online and in her clinic in Pennsylvania. So we would love to help you and get you the resources you need. So know that there is hope out there, right?
Yeah, thank you for having me, Kelly. And I cannot say enough good things about the men's collection and men's program that the Tummy Team has. And I refer people that a lot. And I just think it's a great I think men just do so well with the information and really like appreciate sometimes the online format of it. So I'm just putting a plug in for that's a great resource if you are listening and somebody that could benefit from that. It's an awesome resource.
Yeah, and it's like only $45 a month, and they don't have a contract. I mean, you just use it for as long as you need it, and you have access to all of those. And I think that really helps the men that are like, "Let's go. I want to go, and I can't get into a therapist. I can't find somebody." Like, boy, you could start today. You could start right now. You could start doing it today. And
Right.
I do take you step by step through, and I've used that on thousands of men that are doing really great. So we definitely have those resources for you. So thank you. Thanks again, Megan. I will see you next
Thanks.
time.
Thanks
All
for having
right.
me,
Bye.
Kelly. Bye.
Once again, thank you for joining us at the Tummy Team Journey. We would love to help you restore your core and be strong for the life you were meant to live. You can get more practical strategies at thetummyteam.com, and we'll see you next time.